The next speaker is Professor Stehpahnie Wu. She's Associate Dean of Research, Associate Professor of Surgery of the William Scholl College, Podiatric Medicine at Rosalind Franklin University, North Chicago in Illinois. And she will talk about the American challenges and perspective. Stehpahnie Wu.
Thank you, Dr. Bakker. There's almost 26 million people, about 8% of the population in the United States who have diabetes. Of that, about 7 million people have undiagnosed diabetes and are not aware that they have the disease. If you'll take a look at the diabetes distribution map across the United States, and if you'll take a look at the darkest area, which represent the greatest density of patients with diabetes, we can see that there's a heavy distribution in the southeastern region. And because of this, this area actually spans about 644 counties and 15 states. And because of this high density distribution, this area is coined the diabetes belt by the Center for Disease Control. This graph here shows the prevalence of the number of United States adults who's been diagnosed with diabetes from 1980 to 2010. And from about 1980 to 1990, you can see that the prevalence of diabetes was fairly constant. However, starting 1990 and going upwards, you can see the slow trend of increase in the prevalence of diabetes in the country. Accordingly, the attributable healthcare costs to diabetes in the nation has almost doubled in the past decade, from about $132 billion in 2002 to about $245 billion in 2012. Now, if we look at the incidence, which is the number of new cases of diagnosed diabetes amongst adults in the US, the graph here actually shows a pattern very similar to the prevalence. From about 1980 to about 1990, you can see that there's very little change in the number of new cases that were diagnosed in adults with diabetes. However, starting in about 1992, you can see this increase in the number of new cases that's diagnosed every year. However, if we look more closely at the data, you can see that in the span of 20 years, between 1990 to 2010, the prevalence of people who were diagnosed with diabetes nearly tripled. The Center for Disease Control extrapolated on this data, and they projected at the rate that we're going, by the time 2050 comes, there will be a 4-fold increase in the incidence of diabetes in the United States. What this translates to is that 1 in every 3 United States adults will have diabetes by the year 2050. Well, let's take a look at the lower extremity complications. First, let's start with a blue line, which represents peripheral arterial disease. You can see here from 1988 to about 1991, even though there's a slight dip, it's not significant. So it remained about constant. From about 91 to about 96, 97, you can see this increase in the incidence of peripheral arterial disease. However, from about 96, 97 onwards, you can see this gradual decline in the incidence of peripheral arterial disease. However, if we take a look at the incidence for ulcer, which is represented by the red line, as well as that of neuropathy, represented by the gold line, the two almost looks parallel, and you can see this gradual increase in the incidence of both. What this may be attributable to is the fact that more patients are presenting to get their foot care. They're getting more doctor visits, and they're inspecting their feet. Therefore, more of the ulcers are being diagnosed early on. But what we really care about is the amputation rates. So if you'll take a look at this graph here, which represents the complications associated with diabetes, this dotted green line here represents the amputation rate. You can see from about 1990 to 1995, there is a gradual increase in the lower extremity amputation rate. However, from 1995 onwards, you can see a slow decrease in the rate of amputation in the lower extremity. This correlates well with other diabetes complications, such as that of a heart attack represented by the orange line, stroke represented by the solid green line, kidney disease represented by the dotted blue line, and death secondary to hyperglycemia represented by the black line. Now, all this can be attributed to the diabetes education that the patient has had, as well a lot of the preventative strategies, in addition to the team approach to amputation prevention that has been so heavily emphasized. And this is also evident in the number of patients who actually go to see their foot doctors and obtain their annual foot exam. In the year 2009 to 2010, almost 68% visit their foot doctor on a regular basis. Close to 70% check their blood glucose on a daily basis. And then close to 70% goes to their doctor visits to have their hemoglobin A1C checked more than 2 times a year. And almost 60% attend diabetes education classes. So yes, we are doing much better, but there's much more ways to go because we're nowhere near perfect. And also, there are many challenges that await us as we go through this path on our amputation prevention. One of the biggest obstacles, of course, is obesity. As our television sets seem to get thinner and thinner, our waistline seems to get bigger and wider as we progress. Now, a lot of the patients in the United States, they tend to honor themselves to really the convenience and the affordability of these dollar menus at the fast food places. I cannot tell you the number of times my patients would come in with blood glucose in the 300s, in the 400s, because they cannot resist the buy one, get one free deal at the local fast food place. And also, we as people are getting lazier. People are riding up and down the escalators to go to the gym to work out. And not only do they ride up, they need the escalator to ride themselves down as well. And instead of walking their dog, people actually coast in their car and go in first gear while they go and walk the dog. And when we look for parking, we look for the one that's closest to the door. All these contribute to diabetes being an epidemic in the United States. And if we'll take a look at the obesity distribution map with the darkest color representing the highest density population of those obese, it's actually very similar to that of the diabetes distribution, again, in the southern area where we tend to have more obesity as well as diabetes. In fact, if we look at all the OECD countries, the United States rank upon the highest in terms of the obesity rate in the population. And if we look at the cost burden of obesity-related complications, you can see that diabetes outranks all the other complications and imposes significant correlation with the two. The other issue that we have is with the 7 million people who have undiagnosed diabetes. When I get called in the middle of the night for a diabetic foot infection, oftentimes it's not for the patients that I know. It's for patients who are never even aware that they have diabetes or are in shock that they didn't know that they stepped on something and they have the infection. Many people have insurance, but they choose not to go see their doctor because they're too busy. Others, about 20% of the population, do not have insurance. Now, this is supposedly correctable with the Affordable Care Act, otherwise known as Obamacare, that theoretically will, in the next few years, allow the 33 million people in the US who are not insured to have insurance. The debate goes on about Obamacare. However, the 800-pound gorilla in the room, which nobody's really talking about, is the fact that the projected cost by the year 2022, which is only 8 years away, is going to be $5 trillion with a T. And how are we going to go and provide care for our patients at such high cost? So one state, the state of Arizona, actually in September of 2009, time point 8 here, decided to remove podiatry from their services so they can cut costs. The legislation got signed by point B, which is March of 2010, and it became official in June of 2010, which is point C. Now, Dr. Shrepnick, along with Mills and Armstrong, did a study where they looked at the incidence of patients who were admitted for diabetic foot infections for those who received the Medicaid insurance in Arizona versus the rest of the country. The red line here, you can see the fluctuation is the rest of the US. The blue line here represents the Arizona Medicaid insurance. And you can see that by removing podiatry or the foot exams for these patients, there is a huge increase in the incidence of patients admitted to the hospital for diabetic infection. So yes, this program did help cut the cost. However, for every $1 that they saved, 48 more was actually spent on treating the patients. So while we need strategies to cut costs, we need to think thoroughly before we implement things. And I just like to end with, you see what you look for and recognize what you know. Thank you.